Welcome back, my YouTube friends and family, and happy Monday. This is Lindsay, and I am back with more daily work from home job leads for you. It has been a hot minute, I feel like, since I've done dedicated videos to specific topics. I used to do this all the time, and in the last few weeks, I feel like all of my videos have just been hodgepodge videos of all the jobs that I found. Nothing really had a theme, but today's video is all about the healthcare industry. Healthcare is one of the great industries to be in if you want to work from home. During COVID, when COVID first started, a lot of healthcare companies moved all of their administrative office work, billing jobs, customer service jobs, all the things that did not have to be specifically working hand on hand with a patient to remote work from home, and the healthcare industry has pretty much stayed that way and decided not to go back to the office. So healthcare is a great place to work in if you do want to work from home. So I have 7 different jobs in today's video, all in the healthcare field. We're gonna dive all in. Just real quickly, if you're new here, welcome. This channel is all about searching the internet, looking for the best work from home jobs available. I bring them to you on a daily basis. So if you don't want to miss out, make sure you're subscribed, have those notifications turned on, and in the YouTube description box below this video, there's a link to my website that lists all the Glassdoor pages and application pages if you want to read reviews, get those applications in, and timestamps are also down in the YouTube description box below this video. I do just always ask that if you enjoy my videos, let me know, give this video a thumbs up like button. But without wasting any more time, first up we have the company Molina Healthcare. They have 2,400 reviews from past and current employees, an overall employee satisfaction rating of 3.4 out of 5 stars. They are hiring a process for their COB review, or this is coordination of benefits, which is what COB stands for. This is going to be remote for the United States. All of these jobs I'm sharing are for the United States. I say this in a lot of my videos. My expertise, I do work from home as a hiring manager for a healthcare company in the United States. So that is where my expertise is the United States job market. From time to time, if I come across things that are hiring like in Canada or worldwide or other countries, I will share them. But for the most part, my specialty is in the United States job market. Most of the jobs that I share are in the United States, and I try to say that in every video. I still get comments, so yes, United States only. But Molina Healthcare is looking for somebody to help them coordinate benefits when other insurance carriers are going to be responsible for payments, specifically during where CMS is concerned. So CMS is Centers for Medicare and Medicaid. So if the patient has like Medicare or Medicaid insurance, but then they're like, oh, well, we think they have Blue Cross Blue Shield that should be billed before we are billed. Things like that. You will have to coordinate the benefits in the order in which, when people have more than one insurance, the order in which the insurances are supposed to be billed. So you're going to either use the phone or use the insurance company's online portals to validate state, vendor, and internal COB leads and records. Most of this can be done online in today's world on an online provider portal, but you may have to pick up the phone from time to time and make outbound phone calls to those insurance companies, finding out information about the patient, the coverage, what they have. So internally, you're also going to provide telephone, clerical, and data entry support to the coordination of benefits teams. You're basically updating the insurance table on the claims, transactions, and tracking database, contacting CMS directly when you need to coordinate with things such as Medicare or secondary payer when premium restoration is a concern. Now, they only require a high school diploma or GED, no college degree, but they want somebody who has 1 to 3 years experience in some kind of medical administrative support. Pay for this position is going to be based on things like location and experience. The low end says $12.19 an hour, all the way up to $26.42 an hour. I doubt in today's world they're still paying that $12 an hour range. Next up, though, we have the company Centrix. They have 556 reviews, an overall rating of 3.4 out of 5 stars. They are looking for a claims processing associate. Now, pay for this one is anywhere from $16.35 an hour all all the way up to $20 an hour. But they are looking for somebody to review, investigate their claims, make payment determinations, and process and match claims data with the appropriate authorizations in the system when needed. So these claims you're going to be reviewing are going to be electronic claims. You're going to review the computer-generated edits, determine the correct payment or denial amounts, and document that in your notes. You're going to identify any questionable claims or authorizations in the system that have issues, just doing your production and quality targets that are set by your department. Now, because all of these are healthcare jobs, you will have to follow HIPAA guidelines. They are looking for somebody who has either experience in claims processing, medical services, or some medical terminology, high school diploma or GED, and 1 year of work experience. Now, on top of the pay, they do offer a standard benefit package. Keeping it moving, next up we have the company Tenet Healthcare. They have 1,600 reviews from past and current employees, a 2.9 out of 5-star rating. They are looking for a charge audit specialist. Again, this is remote for the United States, but they're looking for somebody to be responsible for making sure all of the billing charges that are being captured are documented into the system, charged and reimbursed for the assigned department under the correct policies and procedures. You're going to be doing a lot of fact checking with this one. You're going to conduct reviews and audits to identify potential charging and billing issues, including lost revenue opportunities. You're preparing reports based on those findings. So you're going to work with the clinical departments that are impacted to ensure that your audit findings are addressed and assist with the best charging practices moving forward. So you're basically identifying, researching, and analyzing billing errors or omissions, just working with different departments, making sure that you're basically maximizing that revenue potential. So maybe clinics and doctors are dropping charges for like a lower level of care while they're actually providing a higher level of care. You want to be capturing that higher level of care so you can charge those insurance companies more, making sure you're not missing out on that revenue. So that is what you're doing, is just running reports, analyzing everything that's being billed against what is actually being provided to the patient, making sure there's no opportunities to collect additional revenue. Now, they want somebody who has knowledge of like audit principles and guidelines, knowledge of healthcare billing like CPT codes or HCPCS codes, knowledge of content or application published health information like coding conventions, coding clinics, things like that. You've got to have strong computer skills and strong communication skills. Now, way down at the bottom, they do say they prefer an associate's degree, but will take equivalent experience over that. Pay for this one is very high. They're paying anywhere from $30.85 an hour all the way up to $46.28 an hour. Now, next up, we have the company Connect America. If you're interested in this job, please make sure you do your own research on any companies. Come read reviews and find out what people are saying about them. They have 217 reviews on Glassdoor, but they do have a little bit of a lower employee satisfaction rating of 2.6 out of 5 stars. But they are hiring a clinical monitoring specialist, again, remote for the United States. This one pays anywhere from $18 an hour up to $22 an hour. This one is a little bit different. It's not like a standard billing claims job. They are looking for somebody to monitor patients' vital signs, symptoms, and health status daily using their dynamic portal. So you are going to virtually monitor patients. So, if you're in a hospital room, sometimes patients have like those oxygen monitors or all of those monitors hooked up to them where doctors used to have to go in and like read the blood pressure and read the machines and like write down their vital signs at different points of the day. Well, in today's technology world that we have, those machines can be monitored from a computer remotely, so you don't actually have to walk in the room and read the readings off the monitor screens anymore. And so that sounds like that's what this job is doing. You're going to identify individual patients' health trends by assessing their vital signs, symptoms, medication adherence, and other relevant information. This may require you to pick up the phone from time to time and make contact with the patient to speak to them. So you'll engage in regular communication with the patients to kind of assess their well-being, address any concerns they have. You also have to educate the patients on their remote monitoring program, their health devices, and the health promotion. And then you're going to do a lot of data entry, maintaining all of this information and detailed notes in the patient's medical records, their electronic medical record system. They are looking for somebody who has a credentialed medical assistant, someone who has prior experience with monitoring these different devices. If you are bilingual in Spanish or Korean, that's a plus. It's not required. You do have to have great communication skills and great attention to detail for this one, though. If dealing with patients is not really your thing, this next one might be for you. The company is Ventra Health. They have 133 reviews on Glassdoor, an overall rating of 3.9 out of 5 stars. They are hiring a payment posting specialist. So the payment posting specialist is responsible for the monetary intake of the Ventra Health clients. So you're going to be assigned 13 to 14 different facilities or clients, and you're basically responsible for maintaining their deposits and payment posting for all of those different clients. Posting the accounts payable deposits, processing the electronic 835s and manual payer EOBs, including insurance allowables, patient portions like copays, deductibles, denials, adjustments, contractuals, recoups, forwarding balances, all the things. You're going to make sure that you balance and close the payment batches timely. And so you'll have to use payer websites or insurance company websites to obtain the EOBs or explanation of benefits. So what payment posting is in the healthcare field, if you're not aware, is insurance companies, like say you have a healthcare system that bills lots of claims to Blue Cross Blue Shield. Think about a big major hospital corporation near you, or even think about something like St. Jude's Children's Hospital, some kind of a big healthcare system, right? They are sending hundreds, if not thousands of claims a day to insurance companies for all the patients that they're seeing. And when they send those claims to insurance companies don't pay each one by one, because when you're talking thousands, that would literally be a lot of work and take forever. So insurance companies will process like all of these claims in a big batch and send one check. And what they do is they send either like an 835, which is an electronic posting, or they'll send like a paper manual EOB explanation of benefits, and it explains what they paid for this check. So patient, John Doe, we paid his office visit at $200. He has a copay of $10 that he needs to pay. Now, Barbara Smith over here, she was seen for a cancer treatment. We paid $2,000 on her claim. She has a deductible. She owes $1,000. And they just basically go down and list everything that they paid on that check. So in payment posting, you're responsible for basically putting all of that individual breakdown detail into the system, making sure that the big number on the check gets deposited into the little numbers into each patient's account, if that makes any sense. Now, they only require a high school diploma or GED, and they want somebody who has either 2 years in payment posting experience in a healthcare setting or 2 years of being able to read explanation of benefits. You need to know like different insurance types. You've got to be strong at keying and data entry into a computer. So strong organization and time management skills. Pay for this one is anywhere from $16 an hour up to $19 an hour. Next up is the company Revecore, though. Revecore only has 48 reviews from past and current employees, so always do your own research on any company before giving them your personal information. They have an employee satisfaction rating of 3.5 out of 5 stars. They are hiring a health claims specialist. Now, one thing that I don't particularly like about Revecore's website is that they don't have individual job links to their individual jobs. The only link that you have is to come to their main current opportunities page. So the link in the YouTube description box will take you to this page. It is the second one down. It says health claims specialist. If you just click on this, a little pop-up box will pop out with the details of the job. So you will have to look down the list and find that job and click on it. But they are hiring somebody to basically, this is again like insurance billing research, making sure that payment gets done for claims, Medicare, Medicaid, things like that. You're going to research and resolve claims for all their insurance payers, including commercial payers like Blue Cross, United Healthcare. You're going to file the claim forms. The UB04s are for the facility or hospitals, and 1500s are for the physicians with the information to the payers for payment. You'll prepare documentation to notify clients if you need, like, to bill health insurance, Medicare, Medicaid. You'll close and return claims to clients upon using correct text and procedures. Basically just doing all the follow-up activities to determine the claim status and if you can collect from the insurance company or providing information to resolve the claim. So if you get the claim out the door and the insurance company pays, all is well and good. You've collected the money, job done. But a lot of times the insurance company will either request additional information or say that you didn't bill the claim correctly. And so you'll have to follow up, finding out what is wrong with the claim, why they don't pay, make sure that you can basically just get the claims corrected so that the insurance company will pay. This one only requires a high school diploma or GED. They want somebody who has experience handling like large volumes of phone calls. So someone who's worked in like customer service call center type jobs before. Somebody has strong communication skills, and they are looking for somebody to work the Eastern or Central time zones. So way down at the bottom, they are hiring in the United States, but they do have a whole list of states. That's a long list, so I'm not going to read them all. You've got to live in one of these states. Now, the pay for this job was not listed in the actual job description, but if you go down to the bottom here and hit apply for this position, the pop-up box will then tell you the starting pay is $15 an hour for this role. Is this acceptable? And you have to click yes to be able to continue on to put your application in. So pay is $15 an hour. And last but not least, we have the company Savista. Savista has 108 reviews with an employee rating of 3.4 out of 5 stars. They are looking for an accounts receivable specialist, again, remote for the United States. So accounts receivable is still going to be just like those healthcare billing jobs. Accounts receivable or billing and follow-up are mostly used to mean the same thing in the healthcare job world. You're going to be verifying, obtaining eligibility and authorization information for the patients using those insurance payer websites. Just making sure that you collect all the information you need. If you can't, you will have to pick up the phone and call the insurance company to get additional information. You're going to be updating the patient demographics and insurance information into the system as needed. So patient demographics are like their name, date of birth, address, the insurance that they have, their insurance ID number. You're going to research the status of unpaid and denied claims that the insurance company didn't pay, monitoring the claims for any missing information, authorization numbers, things like that you can correct and resend these claims back out to the insurance company to get them paid. So when the insurance company sends that explanation of benefits for the payments that they made, you're going to read those, research those, and make sure all payments and adjustments are put into the computer system correctly, just that the claim is resolved and following up as needed. Now, they only require 2 to 3 years of some kind of medical collections, denials, or appeals experience. They are looking for somebody who knows really a lot of medical terminology like ICD-10 diagnosis codes, CPT codes, HCPCS codes, what NCCI is, NCCI edits, billing guidelines, things like that. You're just familiar with healthcare billing. On top of that, you've got to have great computer skills, like specifically using those Microsoft Word and Excel systems. Pay for this one is anywhere from $18 an hour all the way up to $22 an hour. All right, if you've made it to the end of this video, I owe you a huge thank you so much for watching and supporting me. As always, feel free to leave in the comments anything specific that you're looking for, or if you like these job leads that are more categorized in videos rather than hodgepodge videos, let me know that down below as well. Don't forget, if you did enjoy this, let me know by giving this video a thumbs up, like button. Of course, share with all your friends and family, and I'll be back really soon with more work from home job leads just for you.